a roll call, please.
Commissioner Marecki, Commissioner Dobb,
Here.
Commissioner Anderson, Commissioner Anderson. No, he is here.
Yeah,
Or
he's
was
here.
All right, I'm here.
You were
Commissioner
all-
Killeen,
I'm here.
Chair Baker McCormick,
I'm here.
you have a quorum present.
Thank you. Next item.
B, Chairwoman's remarks.
Just want to wish everyone a happy new year and a safe one as well. Next item.
C,
Oh,
approval
and
of the December 7th.
just before you go there, I meant to say, we have changed the process of our meeting. So we're gonna make a motion to approve all, to recommend to approve all items at the end of the agenda. So you don't have to make any motions on any recommendations. As we move through the items, we'll review the items and then we'll take them all together in one vote. Thank you. Next item.
C, approval of the December 7th, 2021 meeting minutes.
All right, we will take a motion on this.
And I'll move their approval, Madam Chair. Colleen.
Is there support?
Support, Commissioner Dobb.
Thank you. It's been moved and supported. We'll take a voice vote. All those in favor?
Aye.
Aye.
Any opposed? Any abstentions? All right, motion passed. Next item, please.
D, unfinished business. There is none listed.
Next item.
Item 1, under new business, an update regarding COVID-19.
And I believe we have, is Director Jordan here? She is. All right. Well, thank you so much for attending again. And by the way, I think we're going to, after this report, we may not have a continuous report every meeting unless we deem that we need to. So just wanted to let you guys know that.
Thank you very much.
Okay.
My
Go
name
right
is,
ahead.
I'm sorry, my name is Melita Jordan, and I am the Director for Department of Health, Human and Veteran Services. I'd like to again wish everyone a very happy new year. As we start off what I would believe will be a year that is pregnant with potential possibilities for all of us, and wishing everybody to be safe and be healthy. So I'd like to go into doing the weekly COVID-19 report from January 2nd through January the 8th of 2022. We currently have a total of 15,857 new cases reported and 18 new deaths identified in the past week. I just want to report that number one more time. A total of 15,857 new cases were reported during the week of January 2nd through January 8th, and 18 new deaths have been identified. The prior week of December 26th through January 1st, we had 13,142 new confirmed cases. On average, we've had 2,265 cases per day. That's a 21% increase in confirmed cases, as I mentioned, from the previous week of 12/26/2021 through 1/1/2022. Our cumulative cases in Wayne County is 194,152 cases and 3,328 deaths since March of 2020. We have performed 2,412,813 COVID tests, has been administered to residents in Wayne County since March of 2020. We have a 35.4% positivity rate, which is a 3.2 percentage points from the previous week of 12/26/2021 through 1/1/2022. The positivity rate that week was 25.2%. We are still remaining in the high risk transmission noted by the Centers of Disease Control. The county has averaged 8,240 tests per day in diagnostic testing, while the state of Michigan and Detroit has averaged 6,092 tests per day and 7,391 tests per day, respectively, Michigan as well as the city of Detroit. Our predominant variant in the county remains Delta B.1.617.2 with 2,815 total cases, followed by Alpha B.1.1.1.7 at 33%, and I meant to say the Delta was 64%, and I did give you the total number of cases, however. The total number of Alpha cases we have is 1,482 total cases, and Omicron B.1.1.5.2, we have an increase last week of 40 new Omicron cases identified of those who were tested. So we have a total of 87 in Wayne County, which is a 2% of the total cases that have been confirmed. Our hospital occupancy in the surrounding county, the number of adults that have been confirmed that's in the hospital with positive COVID is 1,358. We have 56 children that have been confirmed with a positive COVID that is in the pediatric wards. We have 229 adults that's in the intensive care unit confirmed with COVID. We have 167 adults that are hospitalized that is on a ventilator. 667 individuals was seen in the emergency departments at the hospitals in the community that was related to COVID symptoms. Our breakthrough rate is 2.6% of those fully vaccinated. In the county, there has been 16,150 total vaccine breakthrough cases reported. And of those, 213 deaths and 175 hospitalized. Again, as you know, the fully vaccinated is still considered 2 weeks after their second dose of a 2-dose series, such as Pfizer or BioNTech or Moderna vaccine, or 2 weeks after a single dose of the vaccine, such as Johnson & Johnson. Wayne County's breakthrough case make up 10% of the state's total 159,193 breakthrough cases. Our 5 top municipalities. One is Canton Township with 1,632 cases, or 10% of the total number of the 15,857. Dearborn, 1,583, again, 10% of the total cases. Livonia, 1,164, 7% of the total cases. Westland, 976, or 6% of the total cases. And Dearborn Heights, 850, 5% of the total cases. This concludes my report.
Thank you for that. We will now take any questions for commissioners, but before I move to the commissioners, just wanted to clarify testing kits. I know we discussed that and just wanted to get everyone else kind of clued in on what's going on with that.
Absolutely. Yes, I did speak to you and then talk to others also regarding the at-home rapid COVID-19 test. We have ordered the COVID-19 test that we will be distributing. I will be anticipate receiving later today and or definitely this week, approximately 20,000 at-home COVID-19 tests that will be distributed. In addition to that, as of last night, many of you may have heard on the news that the federal government has now required insurance companies now to, those that are insured, have required them to pay for the at-home over-the-counter COVID-19 tests. That is effective as of Saturday, January the 15th. Therefore, a person can go to their pharmacy, they can use online. They do not need a prescription. If they purchase it themselves, they will be reimbursed, but it will be available. And we're going to make every effort to make sure those individuals who are uninsured, no insurance, or underinsured will be able to also have access to a at-home rapid COVID test to help them self-manage, for them to know what their status is, in addition to allowing them to self-quarantine upon learning their status if they are positive. Any other questions?
Okay, and so will the test that we have be free to the public, or just for clarification?
Yes, all tests are free. Yes, there will be no charge for any at-home COVID-19 tests.
And we're in the process of working out the logistics once you get them, how they will be distributed, or do you already know that?
No, I am working on that as we speak. This, as you know, this is a very fluid situation that is occurring, and I'm trying to keep up as quickly as I possibly can. Again, this was even last night around 7 o'clock that I actually learned that the federal government and its mandate. So as I continue to try to stay up with not only the information that's coming out of Washington, but as well as coming out of Atlanta, I am working as quickly as I possibly can to make sure that we do have a plan in place and that we can address, again, those that, as I said, particularly those that are low income, those who are underinsured, those who live in our SVI areas. I think it's very important that we make sure that they are able to be and have access to at-home COVID tests.
Great, and thank you for working so diligently on that. I just think it's important for folks to know their status so we can help to stop the spread. So thank you for that. Commissioner Vice Chair Colleen has a question.
Thank you, Madam Chair. And good afternoon again, Director Jordan.
Good afternoon.
I believe it's the CARES Act dollars that the county is currently going through, talking about allocations of how we're going to allocate those dollars this year and next year. I believe it's the CARES Act. I'm losing track.
I'm not familiar with those CARES dollars. I have been working, of course, around the ARPA dollars is what I have been dealing with. But not
ARPA, that's what I meant. Yeah,
Okay.
The CARES Act, that's in the past. ARPA. And I was delighted to see that the county was looking at strengthening our public health system with a nice chunk of that, somewhere in the $30 million range, which I think is very appropriate. Are you planning on having some discussions with the Health and Human Services Committee with regards to the plan for how to spend those dollars?
I believe that that was what Mr. Khalil did, was I thought had meetings with various representatives around that. I do believe, if I remember correctly, the last thing I did get from you, that you were asking if I would put together an executive summary or something to share with
Right.
you and others, and I am working on that. Of course, my
Okay.
attention has been to address, at this point, I will be quite frank with you, my attention has been addressing the COVID issue, which is front and center. And so that is where all of my time and my attention is, to make sure that I can address the county with that. But yes, I am working also on those 4 pillars, and I will get to you at the, hopefully at the appropriate time, and be able to present here to the committee in terms of how we're going to move forward with that. But I am working on that. It has not slipped my mind at all.
Well, I understand. We're all right now. And I think I think it would be fair to describe Mr. Rahal's presentation as being at a very high level. It was just summary number and not a lot of detail.
Mhm.
And it would be my hope that before those plans are put into stone, that there be some discussion with the Health and Human Services Committee as those plans are being developed, because I'm very interested in what you see as the priorities. So I'm hopeful, Madam Director, that we can have a discussion of that here before it's all set in stone.
I haven't set anything in stone, so I just want you to know what you saw that day is the direction in which I'm going. I'm not going to change those directions. I think that
No.
the 4 pillars that I have laid out, I think are very clear. I think it's in sync with what all of you have previously shared with me and your concerns. And that is the direction that I'm moving in. I just simply will say to you that my attention has simply been, at this point, focused really at this time in dealing with COVID. And I do plan to, end quote, when I can, I am working also with putting my thoughts down, working and talking to people in terms of how do we engage my health systems. I have been meeting with people like Priority. I've been meeting with people at Beaumont. So I am meeting with folks also, so that I can come back to the committee and say, these are some of your partners out there that we're working with. We are planning to work together, and to share with you that this is the direction, and these are concerns that they probably have already shared with you at some point in your private meetings with them and or committee meetings with them that I've not been part of.
Well, I was delighted to see the commitment that was being made in public health with the ARPA dollars and how we can strengthen ourselves in the long term. So I will, I know you got a lot on your plate, Director. So I'll look forward at a future meeting to having some conversation prior to it being set in stone where the ARPA dollars are going, and what we're choosing to strengthen. Would dearly love to have that conversation a little bit ahead of time.
Sure.
Anyway.
And I would just add to you, I just wanted to add, I have used a small fraction of those ARPA dollars to purchase the at-home COVID-19 test kit. That is where that money is coming from. So I just want you to know that that is the priority, is to make sure that we can serve the residents of the county.
Thank you, Madam Director. Thank you, Madam Chair.
Thank you.
Thank you. And can you also email us your presentation to the clerk, rather, your presentation today?
Absolutely.
Thank you. Commissioner Dobb.
Madam Chair. There's a lot I want to say, but I'm going to try and condense it down. But first of all, thank you so much, Director Jordan, for all of your efforts in trying to fight this pandemic. I can't believe that we're back here again with these numbers. It's, we might as well be back in March 2020. And it frustrates me and it angers me because I know that so many of us have worked so hard to end this, and it feels, to me at least, I feel like I'm in the worst group project ever, where there's some of us who are trying to do the job or trying to do the work, and then there are some who are not doing anything, or they're fighting the rest of us, and we're never going to get our project done because of these people. So I just want to thank you for all of your efforts. And as the commissioner for the community with the #1 case rates, Canton Township, I'm just, I'm really frustrated and I'm really angry. So my question is a couple questions regarding masks. I've heard, and I think it came from the CDC, they are really recommending the KN95 or the N95 masks for the Omicron variant. But I know that you said that our breakdown, we only have 87, well, I'm going to say only 87 cases, only 2% of our cases are Omicron. Are you really recommending that people seek out those KN95 or better masks, or at least, try and double mask? Or do we have any guidance on what kind of masks to wear at this point?
Sure. So a couple of comments to your questions and, of course, your concerns is, one, I think we still are in a better place than where we were in 2020. One, we do have vaccines now, and we do know that the vaccines are reducing the number of people that are severely ill and reducing the number of people that are in hospitals that is literally on and were on ventilation. So I think we are in a better place. Two, remembering that the positivity rate is based on, and the variance is really based on the number of people that's being tested. So again, we don't have 100% to say that that we are capturing every single person with the variant. It's a sequence, as you well know, but we're not capturing everybody. So at this point, we believe that of the number of people that are tested, that 2% of the population here in Wayne County have been impacted and or had the Omicron variant. It does not mean that there are not more Omicron variants present in the community, but I'm not capturing all of that. Far as the mask is concerned, yes, CDC is recommending that moving from cloth mask, and if you are wearing a cloth mask, to double mask those cloth masks. The surgical masks are a good form of a mask to use. Those are the ones, as you know, practitioners, physicians, and others use in a hospital when they do surgery and or if they're doing a procedure. Those are considered the surgical mask, and they are effective. And so that is the mask that people are recommending. Also, yes, the KN95s also are appropriate to wear, particularly if you are in a large crowd and or if you are in an airplane flying and or in an airport, those types of places. Yes, an N95 would be a good one, or an F95 would be a good one to use as well. So
great, thank you. And thank you for your a little bit of encouragement there. I'm just so frustrated when I hear you say that there's 56 children in hospitals with COVID, and now our breakthrough rate is quite a bit higher than it was. It's very discouraging. But we're gonna keep working, and we're not gonna give up. So I guess really that was my only question, is just promoting the masks, proper use of masks, and what kinds of masks people should be wearing at this point. So thank you very much for your efforts. Thank you, Madam Chair. That's all I had.
Thank you, Commissioner Dobb. Let's see, Commissioner Anderson has a question. Go right ahead.
Thank you, Madam Chair. I just had a question for Melita or Ms. Jordan. Ms. Jordan, do we have a breakdown on how many residents have been vaccinated, with fully vaccinated, with one vaccination shot, and the others with two? Do we have a breakdown like that?
yes, we do. And I can actually pull that up for you on my phone.
If you could just send it to us, that would be great. But
Absolutely. I can send that to you as well, but I'm sorry I did not report that in my report. I was trying to be as brief as possible, but yes, I certainly will get you that information as well. But we do, I keep that and generally do report that out as well.
all right, thank you. Thank you. I think and is it not correct that the Omicron variant is most problematic with those that have not, and with the breakthroughs for those that have not had their booster shot on top of the first 2 shots?
That's correct. So first of all, the Omicron variant is actually more contagious. That has been very much demonstrated and shown not only in Africa, but also in Great Britain. So again, it is a very virulent variant. And so therefore, we're trying to make sure that as we are moving forward to address the issue, we're looking really closely, as you see how quickly it went through South Africa. However, the thought was because you have more younger people there as well, it's very warm there as well. It lasted, it peaked, and then it sort of died down. However, we're looking at Great Britain to see what the situation will be there because their population is more similar to our population. And it's wintertime there as it is here. In addition to the age group is very similar to our own age group. We probably will know in the next, I would say 2 to 3 weeks is what the various scientists are saying, that we'll have a better idea that if it will peak and then begin to decline, and or if that is not the case, more than likely then we're in for a rough time in terms of other variants popping up as well. As you know, it's on the Greek alphabet. You know, there's 4 Greek letters, and so we're only through the 2. So I'm suspecting that we probably will have pi next. So we are on the lookout for that as well. Also, those individuals who have not been vaccinated, the unvaccinated is what we're finding with most people that have been admitted to hospitals are unvaccinated and happen to be either very ill and or in intensive care units or ventilated. We also know that individuals who perhaps have not been boosted also have been individuals contacting or have been exposed to the variants, not necessarily Omicron, but it could be Delta too, that they've been exposed to. So we do believe that there is a decline in the immunity after a certain period of time. So it seems like after 5 to 6 months that there is a decline. So that is the push to make sure that those individuals also get boosted. You may have heard just recently as well that there is a thought of maybe a 4th jab, so to speak, or a 4th injection with those who are immunocompromised. And so that is being looked at this time as well. Not a lot of information, but there is some studies again that is happening in Europe that is looking at that to see if we need to do that. But there have been some reports that is speaking to that. I also wanted to share with the committee as well is that because we are at a high transmission rate, because our case count since Thanksgiving has continued to rise, we are actually, will have the CDC is sending what I consider a strike team here to Michigan, actually right here in Wayne County. I have given them 2 areas for them to set up for testing. And we are also at those sites will also be doing vaccinations. And so I am just waiting to hear back from the state as to when CDC will arrive. I anticipate it will be next week. I've given them the information. I have provided them with 2 sites where they will be, and I will alert the committee as well so that you are and can share that information with your constituents also as to where we will be doing testing, and in addition to when they will come. But I anticipate it will be next week. As you know, they've sent strike teams out across the country, and they're sending 4 teams to Michigan. One of those teams, and maybe 2, I've asked for 2, but not sure I'm gonna get 2, but I have asked for 2 that they will be set up here in Wayne County.
thank you again for your work and how much time you're putting into this. And I certainly, and I'm sure other members of the committee, I speak for them, that we appreciate what you're doing. I'd also like to ask, has there been a replacement named for Carol Osterberry?
Yes, there has, and I'm in the process of working through that to get the paperwork up through. First of all, I need to get the paperwork to the state to approve to approve that. But yes, I have identified a person and anticipate their start date will be February the 14th. And I will share all of that with all of you, but the process is still working through all of those logistics. But yes, I have. And also, I have identified a person that I am looking at to replace our juvenile detention director that left back in August. So that position needs to be replaced also. And that's why I mentioned, I think earlier, that, as you know, I have not had a director for our juvenile area. That is a huge work with the implementation of the 17 and over in terms of dealing with the young people, as well as the court system and JDF. Those things take up most of my time. So I had to go out and recruit for a director for that as well. And I do believe I have a candidate. And so I'm hopefully that as we continue through the process that I can bring her on in February as well. So that's where I'm at, and trying to build a team is what I'm trying to do.
Thank you. And I know it's a big undertaking, and but one last thing, and you could give it to me offline if you would. The contact at the state level, that someone that wanted to help with the effort to do COVID testing and vaccinations. If there's someone at the state that they could reach out to, and I'm already going to give them your contact information, your office anyway, not your personal. So if you could offline maybe give that to me, and I don't know anyone else that would like that information on the committee.
Will do.
All right. Thank you so much. And thank you, Madam Chair.
Thank you, Commissioner Anderson. Any other questions from commissioners? Any other questions from commissioners? All right, and I see another hand up, but this is only for commissioners right now. We will take public comments shortly. Thank you, Madam Jordan, Director Jordan, for giving that extensive report, and thank you for all that you do for Wayne County.
Thank you.
All right, Madam Clerk, next item, please. And again, we're going to take all of these items together and then have a recommendation at the end. Okay. Go right ahead, Madam Clerk.
Item 2, requesting commission approval of modification 35 to a contract with 3 one-year options to renew with Black Family Development.
All right. Are there any questions on item 2? Any questions? All right. Item 3. Any questions on item number 3?
Madam Chair.
Yes. I'm sorry, I didn't see you. Go right ahead.
I was just going to state for anyone that might be joining in and not understand why there's not any questions, that the fact that these are our usual expenditures, or if someone would just like to mention what these are. So for the benefit of anyone, those of us that are on the committee certainly have seen these before and these expenditures, and that's why there's not any questions at this time, I think. But I think people would benefit knowing that what they provide in a broad terms.
Sure. Would anyone like to speak from the administration on these items?
Hi, this is Cecily Hoagland. I'm the administrator in the Juvenile Youth Service Division for the Department of Health, Human and Veteran Services. These 4 items are contract amendments. This is the last contract amendment for this contracting period for the CMOs. We started new contracts October 1st. So this is the 4th quarter adjustment for fiscal year 21. We adjust the contracts every quarter based on days of care, and this is the last contract amendment for this contracting period.
Yes, and so these are care management organizations. That's what she meant by CMOs, and they are directly responsible for our juvenile services and have worked with us for many years.
Thank you, Madam Chair, for explaining
All
that.
right. Yep, no problem. And you are correct in that the public wouldn't know why we are just not really asking any questions about this. So, so that was item 3. Any questions, concerns from commissioners on item 4? And then item 5. All right, item 6. No questions. All right, then we'll move to the Madam Clerk.
Item 7, requesting commission approval of the reappointment of Melita Jordan to the Health Choice of Michigan Board of Trustees.
All right, Ms. Jordan, if you'd like to say a few words about this reappointment, you're welcome to do so.
Well, thank you very much. It's been a pleasure to participate to date on the board, and I would like to continue to be able to serve my colleagues as well as the residents, and to help shape the policy and administer the fiduciary responsibility that the board has. And it has been my pleasure over these last 8 months, and I look forward to another year of working with everyone in terms of making sure that we can not only provide businesses with the lower cost for insurance for their employees, but also to be able to support them and the work in which they do and how they support our county. Thank you.
Thank you. Health Choice is a great program that we administer in the county to help small businesses provide health insurance for their employees. So we thank you for all that you do again and will do on the Health Choice Board. And we have Commissioner Colleen, Vice Chair, that would like to say a few words.
Thank you, Madam Chair. I sit on that board as well as the chair of the committee, and I want to say to people that under the law, Ms. Jordan joins us because of her position in the county. There are certain named positions that people that fill those positions serve on the board. So we will have to replace Ms. Osterberry at the appropriate time on that board, but that's why it's there. And Madam Chair, as long as I'm here, if there's no other questions, I think the proper motion here is to move to recommend items, what is it, 2 through 7?
Did we have another addenda item? I thought we had one more.
Oh, I thought this was it. If I'm early,
It's just this one.
It was just this one. Okay, great. Go right ahead, Vice Chair. Mhm.
well, then I believe, until I hear from Commission Council otherwise, that the motion would be to recommend to the full board, I believe it's items 2 through 7.
Correct.
Yes. So that's my
Or
motion,
6, 2, yeah, through 7 is the addenda
yeah,
item. Yes,
including that. Yep.
yes.
Support Anderson.
All right, it's been moved and supported that this recommendation be moved to the full board. Can we get a roll call vote, Madam Clerk?
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson,
Yes.
Commissioner Killeen,
Aye.
Chair Baker McCormick,
Yes. Any one opposed? Any abstentions? All right, motion passed. Thank you. Next item.
F, such other matters as may be properly submitted before the committee.
There are no such other matters. Next item.
Public comments.
Any public comments? We do not respond to public comments, and you have 1 minute. If there's anyone that would like to address the commission. Madam Clerk, is there any emails or anyone that would like to address?
We haven't received any emails.
Okay. And we have 2 hands up, looks like. We'll start with, I believe this is Miss Billy Schwartz. Schultz, I'm sorry.
That's okay. We do not need vaccine clinics in our schools. When you can go to any corner and get a vaccine, these medical needs need to be kept in the pediatrician office, not in the schools. The masks are not working. When are we going to acknowledge that? Why are we not spending more time and money on mental health and keeping schools safe? I am going to give you the numbers of 2020 for suicide rates here in Michigan. These rates are per 100,000 population for specific age groups. 5 to 14, suicide by gun, 1.6, hangings, 0.4, overall, 1.6, age groups 12 to 24, guns, 7.8, hangings, 5.1, poisoning, 1.1, other, 1.5, overall, 16.8. 6.2 are female and 25.2 are male. That is higher than the US rate at 23.8 for males. This doesn't even include the 2021 or suicide attempts or self-harming that students are doing. This is what is killing our children, not COVID. Where are the Wayne County suicide data? I can only find the state of Michigan and other counties, but not Wayne County. I would like someone to email me and notify me of the data for Wayne County and provide that information or where we can locate the suicide rates for our youth. Thank you.
Thank you. All right, Shannon.
Hello, yes. Hi, yes, my name is Shannon Seco. I'm in Wayne County. And I just want to ask Ms. Jordan, if you could, perhaps I'm frustrated as well as, we're trying to work so hard to get, past this. And it's been 3 years since 2 weeks of full the spread. I was wondering if we can look at other with the hierarchy of safety and control with the regards to mask, I think a lot of what's happening is just they're getting contaminated. Myself, I'm a nurse, and we have to have special training with downing and doffing the materials that we wear to, protect ourselves. So I'm wondering if we can try more of a approach with, eliminating the hazard as far as better air quality in the schools. Perhaps, for masks, have like the OSHA hazmat bins for the mask, because you find the mask on the floor and they're just contaminating themselves. And also with preventative and really pushing that preventative health with healthy living, diet, vitamin supplement, early treatment. The big thing with the schools right now is they're trying to struggle with feeding the children because of the issues. I was just on the state board meeting this morning, and they had a speaker about the food that's not high quality. So as a nurse, I'm a holistic nurse, and I kind of look at the whole thing, not just zero in on mask, but also look at all these other elements that we could also just attack this with everything we have. So that's what I just wanted to bring out to the table. Thank you so much for all you do.
Thank you. And it looks like a Yahoo email address. Have your hand up.
Hi, my name is Daniela. My question is for Melita. Can you hear me, Melita? I'm so sorry. I don't know.
Yes,
Okay,
we can
good.
hear you.
So I'm a frontline nurse. I work in the thick of things. I'm in the ER. I am seeing vaccinated and unvaccinated patients coming in left and right. I think this is a failed vaccine. On top of that, when they're sending these patients home, the ones that are not admitted, they're sending them home with no medications. They're sending them home with no numbers to go get monoclonal antibodies. This concerns me because early treatment is to prevent them from coming back into the ER. What they end up doing is they go home, they get sicker, they come back, they get intubated. The remdesivir, it's not working. It is not working in the hospital. Number 2 on the World Health Organization for antivirals was remdesivir and then was ivermectin. They've taken the ivermectin completely off the table per Fauci. Why is that? The infectious and disease doctors would like to actually prescribe it, but they say they can't because they will have their license taken. Vitamin D, you need to get your vitamin D levels above 90. Per the CDC study, they said that the patients that died in the very beginning of 2020 were vitamin D deficient. Why isn't that being done for all of our children? Why aren't our children getting vitamin D tests and getting their levels way above 90? These are so important because that deflects you from getting COVID. I have never gotten COVID. I work in the ER. I have not been vaccinated, and nor will I ever be vaccinated.
Thank you.
Thank you.
Thank you. All right, any other comments? Any other comments? All right, no other hands are up, and we don't have any emails, Madam Clerk, right? Is that correct?
That's correct.
All right, then we are done with our public comments. Next item, please.
Adjournment.
All right.
Support, Araki.
All right. Thank you, and you all have a great day.
Bye.
You as well.
Bye.